Imagine having family members that have a condition that you know very little about. Well, that is what I have had to deal with most of my life. My sisters are all older than me, and they were all born with a condition called cerebral palsy. I also have a 7-year-old niece who was born with the same condition. For quite a while, I have wanted to get a better understanding of their condition and what they are going through. So, I have done a lot of research on cerebral palsy. Today, I am going to share with you what cerebral palsy is, its types, its history, its symptoms, and its treatments. To begin, what is cerebral palsy? Cerebral palsy is also known for short as CP. Merriam-Webster's dictionary says that cerebral palsy is a disability resulting from damage to the brain before, during, or after birth, and outwardly manifested by muscular incoordination and speech disturbances. It is not progressive, so it means it will not get worse through time, and it is not contagious, so you can't catch it from somebody who has it. It is also the most common lifelong disability in America. The Cerebral Palsy Association estimates that between 500,000 and 700,000 people have CP. 1 in every 1,000 babies are born with CP, and it is also estimated that 3,500 to 4,000 infants are born with CP, and an additional 1,500 children preschool age are diagnosed with CP. Since we now know some information about CP, what is the history behind this condition? Well, it was not studied until the 1800s. This is Dr. William John Little. He was the first doctor to write about CP. In the 1840s, he studied infants and young children who developed stiff spastic muscles in the arms and legs. He believed the condition was caused by a brain injury during birth. This is Dr. William Osler. In 1889, he was the first to use the term cerebral palsy. He believed CP was caused by a complicated birth, loss of oxygen, seizures, or bleeding in the brain before or after birth. This is Sigmund Freud. In 1897, he believed that children who developed CP had difficulty with brain development before birth, not during, and that belief is still commonly used today. Few scientists were interested in studying CP in the beginning of the 20th century because of trying to find a cure for polio. But after the polio vaccines in the 1950s, they were free to study CP. Let's see what scientists have found about the types of CP. Spastic CP is the most common cerebral palsy. It occurs in 70% of all cases. It often occurs when an injury damages the connection between the brain and spinal cord. Ataxic CP is the least common form. It only occurs in 5 to 10% of all cases. It is characterized by unsteady walking, lack of coordination, and poor balance. Athenoid CP occurs in 10 to 20% of cases and is characterized by slow twisting movements, often in the hands and face. There is also a type called a mixed type condition, and that occurs in about 10% of patients. What happens here is there are problems with muscle control and involuntary movements. The most common combination is spastic and athenoid, but other combinations can occur. The term cerebral palsy is so broad that doctors and cerebral palsy experts prefer to use the term that describes the part of body that is affected. Monoplasia affects only one limb. Diplasia primarily affects the legs. Hemiplasia affects one side of the body but not the other, and quadriplasia affects all 4 limbs equally. Other conditions may appear because of the injury to the brain or because of slow brain development. Some of these conditions are vision, speech, or hearing problems, learning disabilities such as ADHD, seizures or epilepsy, slower than average learning skills, and problems with eating, breathing, swallowing, and speaking in severe CP cases. Now that we know about the types of CP, what symptoms should you look for? Well, symptoms usually do not present until a child is between 6 and 9 months of age, except for in severe cases where the baby may be born with an irregular posture or have a body that is either very limp or very stiff. Other symptoms include poor reflexes, lack of coordination, scissor walking, which is shown here, which is where the legs cross over in front of each other as the person is walking, poor motor development, bone and joint deformities, and toe walking, which is here, which is where the child is walking on the tips of their toes, or problems with balance. Another symptom is involuntary movements, such as chorea, which is sudden jerking movements of the head, neck, arms, or legs, dystonia, which is repeated twisting postures of the body, arm, leg, or face, or rigidity, which is just overly tense muscle tone, which seriously limits the person's ability to move. As you can see, there are a lot of symptoms of CP, but there are also a lot of ways to manage them. Some of these ways are walkers and braces, like shown here, surgery, medications that can help control muscle spasms, that can relieve pain, or they can control seizures, surgery to correct abnormalities or to release tight muscles, communication aids shown here, such as computers and wheelchairs, crutches, or canes to help the patients be more ambulatory. The treatment focuses on helping the patient get as many motor skills as they can, or to learn how to compensate without them. There is no known cure for CP, but you can tell there are many ways to help manage this condition. Today we have learned about what cerebral palsy is, its history, types, and symptoms and treatments. There are many people who have this condition and learn how to cope with it very well. If you ever get the opportunity to work with someone with CP, be sure to focus on the things that they can do versus what they cannot. Just because a person has CP does not mean that they are helpless. Please keep that in mind. Thank you.